Hi everyone, welcome back to my YouTube channel. If you are watching me for the first time, hi, welcome. I'm Patok Tilokwe by name. I'm a registered nurse, a writer, and also a natural hair enthusiast. I create content around nursing, lifestyle, self-development, and natural hair. If this is something you are interested in, please hit the subscribe button to join the family. And if you are watching me for the second time, the third time, or the fourth time, hi, welcome. How are you doing? Have you subscribed? Today, I'll be sharing with you how a quack, an auxiliary nurse, almost ruined my professional career. In the hospital I work post-graduation, there is two registered nurse, issue, and the rest are quacks, auxiliaries. And if you have ever worked in this kind of setting, you will know that there's always this tension that exists between nurses and quacks. So one day we had two patients in the ward. One is a cancer patient undergoing blood transfusion, and the other patient is a regular patient. The other patient is on alternate fluid, I think normal saline and dextrose saline alternatively. And I was the one that went to commence the blood transfusion, so I was monitoring the blood transfusion. When it was time for the other person fluid to be changed, the auxiliary went in to change the fluid. So when I checked our documentation, I realized that he wrote normal saline instead of dextrose saline because the previous fluid that got finished was normal saline. And I said, in this doctor's order, there is normal saline alternate with dextrose saline. That's how she flared up and said she know what she's doing, that I should not teach her work. She has 12 years experience. Hey, can you imagine that she has 12 years experience, and the fact that I'm working as a registered nurse does not mean I earn my own license. Maybe I've bought it. And I told her that if it is easy to buy, she too should go ahead to buy the license. So that was how it started. And I realized that other quacks, other auxiliaries backed her up. So that night, that same night that we had the fight, we had an emergency. They brought a boy having asthmatic attack, and the doctor ordered salbutamol nebules 5 milligram to nebulize the boy. And because I want to calm down and see what she will do, as my living God, my sky daddy will have it, this lady went ahead to carry injection salbutamol, and injection salbutamol always comes in 0.5 milligram per 1 ml. So she carry injection salbutamol in 0.5 milligram, she carry two, that is 1 milligram, and she nebulized the boy. I didn't even notice. She nebulized the boy and they went home.
2,000 years later.
I heard a knock at the gate and they brought him back the boy, saying he's having the same attack. And I was like, if the boy is actually nebulized with nebules, he shouldn't be having the attack again. And I went back to the case file. Thankfully, before they left, there is two salbutamol injection in the pharmacy. So I went there to check and I realized that there is no salbutamol injection again, and the nebules are still completing. And I told this girl that you actually nebulize with injection, and he said no, she didn't nebulize with injection, kiniko kiniko. And I told her that there are two injections salbutamol in this pharmacy and the two are missing. How come? There is nowhere for her to hide. So we now nebulize again. I know I made mistake by not cross-checking and leaving her to do it. But what if it is something that is not reversible? This girl will have put me in trouble, like big trouble at that. I've not even used my license, not even enjoy it, and ekwaku now make them seize it. Oh, possible. That's when I put one and two together and be like, I must not stay long in this setting. If you are a registered nurse, you have to be careful and you have to make enquiry about the organization you are going into. Ask questions in your professional platform. If you haven't watched my video about things I wish to know before taking my first nursing job as a Nigerian nurse, please go and check it out so that you don't make that mistake. If you like this video, please don't forget to like, share and subscribe, and comment in the comment section if you ever had an encounter or experience with all these quacks.